Hello, my name is Kristy Fluty, and I'm going to be talking to you about the barriers to ethical nursing practice for older adults in long-term care facilities and how ethical issues facing nurses treating older adults affect their overall care. The study design. In 2018, an article in the Journal of Clinical Nursing, the study was shown in a qualitative descriptive design using a purposive sample of registered nurses who cared for patients in long-term care facilities. The data was analyzed by qualitative content analysis. The key points of the study found. The study found 5 recurrent themes after interviewing nurses related to barriers to ethical care of older adults. There was the emotional stress of death of patients and the demanding families, difficulty coping with emergency situations, and the communication with older adults. The emotional stress. When facing death and the chronicity of patients that they cared for, long-term periods of time increased feelings of stress. The greatest emotional stress involved frequently facing death of their aging patients with do not resuscitate orders. Associated behaviors of family members of patients increased nurses' emotional stress. And then the emotional stress also increased when nurses felt there was nothing they could do with worsening health, such as when patients had cancer or dementia. Difficulties coping with emergencies. Participants felt they were underprepared for emergency situations that occurred in the long-term care facilities, including, and not limited to, falls, hypoglycemia, hypotension, and cardiac arrest. Participants also noted feelings of guilt related to delayed emergency care when cardiac arrest patients died en route to the hospital. Communication with older adults. Impaired cognitive abilities and hearing difficulties increased difficulties while attempting to communicate with older adults. This resulted in patients' needs not being met timely, if they were met at all. Nurses expressed frustration and feelings of guilt related to not being able to fully communicate with their patients. Implementation for nursing practice and personal application. This study shows that the relevance for nursing practice to decrease ethical dilemmas include providing counseling services, continuing education for geriatric populations, as well as increased training for emergency situations. Although I do not practice in a long-term care facility, a large majority of patients that I do see are geriatric, and I too face the same ethical issues that the nurses in this study discussed. My plan for personal application related to this study is to seek out additional continuing education related specifically to geriatric care to better prepare myself for this population. And this is the references that I obtained all of my information from. Thank you.